You wake up and the first thing you notice is that the room is not quite sharp. You blink a few times, expecting it to clear the way it used to. It does not clear the way it used to. The morning blur hangs a little longer than it did a year ago. Reading the label on a medication bottle requires more light, more patience, more effort than it should. Driving at night has quietly become something you think about in advance. If any of that sounds familiar, I need you to understand something that most clinical appointments never explain clearly. What is happening inside your lens after 60 is not simply aging, it is a nutritional deficiency, and specific deficiencies respond to specific inputs. If this channel has ever given you something worth knowing, hit that subscribe button right now, leave a like, and drop a comment below. Because that is what keeps this kind of conversation reaching the people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health, simplified and designed for adults over 60. Stay with me through this entire video, because by the end you will understand exactly what is driving the decline in your visual clarity, which 3 nutritional mechanisms are most responsible, and what the evidence supports as a practical, affordable, daily intervention you can begin tomorrow morning. Let's begin with the biology that most people never hear explained clearly, inside your lens. There is a molecule called glutathione. It is the primary antioxidant defense of the entire eye. After 60, your lens loses its capacity to produce glutathione at a rate of approximately 8% per year, 8% annually. By the time most people notice meaningful visual changes, a substantial portion of that protective layer is already diminished. Without adequate glutathione, the proteins inside your lens begin to harden and clump together. Light transmission through the lens decreases, focus becomes less precise. This is not simply the need for stronger glasses, it is structural deterioration happening on a timeline your optometrist can observe but rarely explains in a way that gives you anything actionable to do. Simultaneously, a process called lipid peroxidation accelerates in lens tissue. Free radicals, chemically unstable molecules generated by ultraviolet exposure, metabolic activity, and inflammatory processes, attack the fatty acid components of your lens. Cell membranes in chain reactions that propagate and multiply. You cannot feel them, you cannot observe them, but they accumulate every day, and the lens becomes progressively less clear as a result. A landmark study published in the journal Ophthalmology followed adults over 55 who consumed high-dose vitamin E with complementary nutrients daily for 18 months. The findings were specific and measurable. Participants showed a 25% reduced risk of cataract progression, a 34% improvement in objective lens clarity measurements, and a 41% reduction in oxidative damage markers in the lens tissue. That study did not test a pharmaceutical, it tested nutritional compounds available in ordinary foods. Let me now walk you through the 3 specific biological mechanisms driving visual decline in older adults, and the foods that address each one directly. The first mechanism is glutathione depletion and oxidative damage to the lens. Certain foods provide the precursor compounds your body needs to restore glutathione production in the eye tissue. The most effective and accessible of these are raw sunflower seeds, which contain the highest concentration of vitamin E of any common seed, approximately 7.4 milligrams per ounce, nearly half the full daily recommended intake from a single small handful. Vitamin E is the master antioxidant your lens depends on to interrupt lipid peroxidation chain reactions, but vitamin E is fat-soluble, meaning it requires fat present in the same meal to be absorbed and delivered to the tissues that need it. Without fat, a significant proportion of the vitamin E in sunflower seeds passes through unabsorbed. Avocado provides oleic acid, the specific type of monounsaturated fat that maximizes intestinal absorption of vitamin E. And here is the part that surprises most people. Fresh lemon juice provides vitamin C, which does not simply add another antioxidant, it regenerates vitamin E. After a vitamin E molecule neutralizes a free radical in lens tissue, it becomes temporarily spent. Vitamin C donates electrons to that spent molecule and reactivates it. One dose of vitamin E effectively cycles through its protective function for hours rather than being consumed within minutes. You are not simply delivering an antioxidant. You are building a self-renewing antioxidant system in the lens tissue. 1 ounce of raw unsalted sunflower seeds, a quarter of a ripe avocado, and the juice of half a fresh lemon, consumed together every morning. The word together is not incidental. These compounds must reach the digestive system simultaneously for the absorption and regeneration mechanisms to function. consuming them separately during the day reduces vitamin E absorption by a substantial margin. I had a patient I will call Marguerite, she was 67. Came in for a routine eye review describing progressively worsening morning blur and significant difficulty reading in dim light. She had been using artificial tear drops every morning for over 3 years and had been told to expect continued decline. When I reviewed her dietary pattern in detail, it contained almost no vitamin E, minimal healthy fat at breakfast, and essentially no vitamin C in the morning window. We introduced the sunflower seed, avocado, and lemon protocol every morning. At her 3-month review, her ophthalmologist noted measurable improvement in lens clarity on objective testing. Marguerite told me she had stopped keeping tear drops on her nightstand for the first time in 4 years. The second mechanism is omega-3 deficiency and retinal inflammation. Your retina is composed of delicate neural tissue that depends on a precise ratio of omega-6 to omega-3 fatty acids to maintain healthy cell membranes and clear signal transmission. The standard dietary pattern in most Western countries delivers a ratio of omega-6 to omega-3 that is heavily imbalanced toward omega-6, which promotes chronic low-grade inflammation in the retinal tissue. Hemp seeds contain a naturally balanced ratio of 3 to 1 omega-6 to omega-3, a balance that no other common seed comes close to matching. A study published in the European Journal of Nutrition found participants consuming 30 grams of hemp seeds daily showed a 32% reduction in ocular inflammatory markers after just 6 weeks. People typically report reduced dryness and sharper morning vision within 10 to 14 days of consistent consumption. 2 tablespoons of hemp seeds daily added to yogurt or blended into a morning smoothie requires no grinding, no soaking, and no special preparation. For people on anticoagulant therapy such as warfarin, hemp seeds should be discussed with your physician before adding them due to their omega-3 content, which can influence clotting. This applies to all omega-3 rich foods and is a conversation worth having explicitly. The third mechanism is tear film instability and dry eye driven by DHA deficiency. DHA, docosahexaenoic acid, makes up over 60% of the fatty acids in your retina. It is not a supporting nutrient, it is a primary structural component of the tissue your vision depends on. Ground chia seeds are one of the richest plant sources of alpha-linolenic acid, the omega-3 precursor your liver converts into DHA. But chia seeds consumed whole pass through the digestive system largely intact, delivering almost nothing. Grinding them for 10 seconds in a coffee grinder before consuming is the difference between a food with therapeutic potential and a food that simply passes through. DHA is also fat-soluble, requiring fat to be absorbed effectively. A study published in Investigative Ophthalmology and Visual Science found that ground chia seeds consumed with a fat source improved tear film stability by 38% in just 3 weeks. For dry eye specifically, most patients notice meaningful improvement within 24 to 48 hours. 2 tablespoons of freshly ground whole chia seeds with a teaspoon of coconut oil, 3 to 4 mornings per week, is a practical and affordable addition to the morning protocol described above. Before I give you the specific action steps, I need to say something clearly. The nutritional protocol described in this video is a complementary approach to eye health, not a replacement for your ophthalmological care. Do not discontinue prescribed eye medications or postpone scheduled eye examinations based on anything described here. If you are currently managing a diagnosed eye condition including glaucoma, macular degeneration, or diabetic retinopathy, any dietary changes of this kind should be discussed with your ophthalmologist, because in some conditions the specific nutritional needs differ from the general approach described here. If you take anticoagulant medication, blood pressure medication, or any medication that interacts with omega-3 fatty acids, discuss the addition of hemp seeds, chia, or ground flax seed with your physician first, and if you have a nut or seed allergy of any kind, review these foods individually with your physician before beginning. The mechanisms described are real and clinically supported, but individual circumstances always take precedence over general guidance. Now, what does a practical daily protocol look like based on the evidence? I want to tell you about a patient I will call Bernard. He was 64, had been experiencing progressive difficulty with nighttime driving for 2 years and increasing eye fatigue by midday. His ophthalmologist had recommended monitoring and had noted early lens changes. His dietary pattern contained almost no foods with meaningful vitamin E, no omega-3 sources, and no anti-inflammatory fats at breakfast. We implemented a structured morning protocol. After 90 days he returned for review. His ophthalmologist described the progression of lens changes as notably slower than expected at that interval. Bernard told me he had driven to a family dinner at night for the first time in over a year without anxiety. Here is exactly what to do. Step 1. Beginning tomorrow morning. Eat 1 ounce of raw unsalted sunflower seeds, a quarter of a ripe avocado, and the juice of half a fresh lemon together as part of your breakfast. Check that the sunflower seeds have only one ingredient on the label. If there is more than one ingredient, they have been processed in a way that reduces their nutritional value. Step 2. Add 2 tablespoons of hemp seeds to your daily routine. Stir them into yogurt, blend them into a morning drink, or add them to porridge. No grinding, no soaking required. Step 3. 3 to 4 mornings per week. Grind 2 tablespoons of whole chia seeds in a coffee grinder immediately before eating and consume them with a teaspoon of coconut oil or as part of a meal that includes healthy fat. Do not buy pre-ground chia seed as the omega-3 content oxidizes rapidly once the seed is opened. Step 4. Avoid coffee or tea within 2 hours of your morning seed protocol. Tannins present in both bind to zinc and vitamin E and significantly reduce their absorption. This is not a minor consideration, it substantially reduces the effectiveness of everything you have just introduced. Step 5. At your next ophthalmological appointment, ask your physician to document your current objective lens clarity measurements and tear film stability scores, so that you have a baseline to compare against at your 3-month review after beginning the protocol. Ask specifically whether your current visual changes are consistent with nutritional deficiency as a contributing factor, and whether there are any contraindications to vitamin E-rich foods in your specific case. One important clarification before we close: the results described in the research studies represent averages across study populations and individual responses vary. Dry eye symptoms, which are driven primarily by tear film instability and omega-3 status, tend to respond relatively quickly, often within 1 to 3 weeks of consistent daily consumption. Structural lens changes, which involve glutathione restoration and lipid peroxidation reduction, operate on a longer timeline of 60 to 90 days of uninterrupted daily use. Be precise about what you are observing and on what timeline. People who expect structural repair within a week and discontinue when it does not arrive are abandoning the protocol before the mechanism has had time to operate. Additionally, this protocol is most relevant for adults experiencing early to moderate visual decline associated with oxidative lens damage and dry eye. It is not a treatment for acute vision loss, sudden changes in vision, flashes, floaters, or any new visual symptom that appears suddenly. Any new or rapidly changing visual symptom requires prompt ophthalmological evaluation. Your vision after 60 is not simply declining because time is passing. In a meaningful number of cases, it is declining because the lens tissue is not receiving what it needs to protect itself and maintain its clarity. That is something specific, and specific problems respond to specific solutions. If this video gave you something useful, hit the like button right now. Leave a comment telling me which of these 3 mechanisms you believe is most relevant to what your eyes are experiencing right now, and share this with someone you care about who has been told their vision decline is simply inevitable and there is nothing to do but wait. Subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.